One of the loudest concerns we always hear, across legal markets when they start as medical and then transform into rec, uh, is that the rec market will just erode the medical market. So I was wondering if you could speak to that and to those folks who have that concern specifically of how this petition protects rather than replaces medical cannabis access.
Yeah, definitely. And that's a huge thing for us as, proponents, campaigners for 788, folks that stick around and defend it and defends patient access. I mean, one of the first rules of politics is do no harm in what you're trying to do. So, this kind of it flops back a little bit. We'd had a similar system in 818 and 819, but we were able to streamline it once again. The big issue that I think a lot of folks in the industry had with 820 was that, like other states, it created a duplicate license system. You would have a license for medical and a license for recreational. And so that's what we're not doing in 837, which is so foundational to protecting patient access. And here's why. So we have the benefit of learning of what happened in other states when they went about it this way. And fundamentally, what it created was yet another license that had to be achieved. So what did that process look like? Those things were fraught with pitfalls, from inclusion programs to limited number of licenses. Was that a lottery? I mean, it had problems everywhere. Also, what it did was it forced operators to make a choice. Are we going to, because they had different sets of regs for medical than they did recreational. And so it forced operators to have to make a decision. Are we going to grow product for the recreational side of the market, or are we going to grow product for the medical side of the market? And so most operators saying, okay, well, the greater market is going to be recreational because anyone can get it. If patients really want it, they can just go over there and get it. They, in essence, dried up access to product over on the medical side. So we talked a lot about this with everyone when we wrote original language, and the concept is simple: is that marijuana is marijuana. The difference between medical and recreational use is the intent of the consumer. Why are you consuming this? To cure your cancer, or just because you want to go fishing and smoke a joint? But at the end of the day, it's still all the same product. It's all marijuana. So there's no need to create a duplicate system. The product is there, and we simply say, hey, all licenses are now marijuana licenses. The difference is the cash register. If you have a medical card, you won't pay an excise tax. We remove the 7% excise tax. If you're state ID, then you're going to pay a 10% excise tax on adult use sales. So what that basically does is there's nothing that has to happen other than at the point of sale system for the dispensary.